Hello and welcome to another edition of the Mission TV show, part of the series that we're recording in a booth here on the exhibit hall floor of the 2015 General Conference. And I have with me today Pastor Dr. Jacob Prabhakar.
Pleasure meeting you, Pastor.
Yeah, good to meet you,
Good to meet you.
Dr. Prabhakar. And your ministry here is called Eyes for India.
Right.
That's a
Right.
wonderful title. And what it says, giving sight to the blind.
Right, Pastor.
Can you tell us about what you're doing in India and how this is working?
You know, India is a country, a large country with
Yes.
1.2 billion people.
Wow.
Of these 1.2 billion, only 2% of the population know about Jesus. And rest of the population is mostly composed of Indians, Hindus. They haven't heard about Jesus. Eyes for India is a ministry that is changing lives. It's not only opening the physical eyes, but it's also opening the spiritual eyes of these millions and millions of people across India. We find these people, most of them in the rural areas. We have 15 million blind people across India, and most of them are confined to the rural communities across the rural states of India. They do not have health care. They are financially not sound, they are poor, they're illiterate, they haven't heard about Jesus. The only way to enter into the hearts of these people who haven't heard about Jesus is through medical ministry. Medical ministry is an entering wedge. It's the right arm of the gospel. And so we, just like as Jesus did when he was on this earth, he went to the people where they were. He ministered unto them. He attended unto their physical needs. And then he bid them, come unto me.
Wonderful.
Just as Jesus did, we go to the people where they are. And so Eyes for India is a ministry that reaches the people to the unreached areas. We set up clinics. We make makeshift clinics in the rural areas. Mostly our ministry is in the Hindu temples, Sikh temples, Muslim communities. We set up clinics. We screen about 1,500 to 2,000 patients in a single day.
Wow.
We identify about 200 to 300 patients requiring cataract surgery. We start our surgeries about 5 o'clock in the evening, and by midnight or so, we would have finished all of them, 250 surgeries, in 6 to 8 hours.
Wow.
We've improvised a technique that is very, very less time consuming, less than 2 minutes.
Wow.
In 1 hour, we finished 30, 35 surgeries. In one day, 200 to 300. Sometimes we have done 400. There was a day I've done 465 surgeries just in one day.
Wow.
The Lord is blessing this ministry in a big way.
Yeah.
When the surgeries are over, we keep the patients with us for 1 or 2 or 3 days for post-operative care. And while these patients are with us, we spend time praying with these patients, sharing the gospel, giving them Bible study. Each patient who goes through this surgery goes back with a steps to Christ booklet in their very own language. So they
Wonderful.
can go back and read.
Yeah.
And some of them who cannot read, will enable their relatives or children, grandchildren to read for them.
Okay.
It's an exciting ministry. It's a life-changing ministry. And we are so excited to help these poor patients who otherwise will not afford a cataract surgery.
Wow. So they what describe their life before and after and the reaction to the surgery.
Most of these patients whom we visit and meet them are bilaterally blind. They are poor. They have no means of living.
That means both their eyes are blind.
Both their eyes are blind.
Okay.
And added to this burden of poverty is blindness. So they are unable to earn anything. They are unable to do anything. Their routine chores of life. They cannot even go to the bathroom. Even the food that they eat are unable to see. And most of these patients do not have their children to take care of them. So they are really living in utter poverty, compounded by blindness. And so they are not only living in difficult circumstances, but living in terrible darkness, they are unable to see the beauty of God's creation.
Yes, and then they get this cataract
And
surgery.
once they get this cataract removed in less than 2 minutes, and the recovery is so quick, in one day, they go back home exciting, praising God that they're able to see the beauty of God's creation. They're able to see their children. They're able to do their works. They're able to carry on with their routine works. Some of them go back to their workplaces for work, and this is a tremendous change in their lives.
Yes.
They're able to live longer. It's very exciting.
So the cataract comes in later in life, and it comes in slowly. Is that correct?
Yes, it is an aging process.
Uh-huh.
But in India, it comes in very early age, 40, 50, 60 years of age. And it cripples their lives once the cataract sets in, because they find it be very blurring, they're unable to see. And most of these patients think that it is part of life.
Wow.
And so they go on with it, think that blindness is part of their aging process.
Right.
And in addition to this, they have no health care. There's no healthcare services in the rural areas.
Uh-huh.
And so they have no means even to go to the places where they have health care. So they live in blindness.
Wow. And so this is an amazing, what is it like to see their face, the look on their face when they first take the bandages off?
Oh, you can see the glow. There is a radiance around their face. They can smile. They are so excited. They say they feel that they have seen God because they know that God is changing their lives. It's like a miracle. They come and go back home fully recovered, seeing again.
Amazing, amazing. So doctor, then how can we get involved? I see you have a beautiful brochure here. Is this something that people, our viewers, can
Yes. Eyes for India is a ministry that has been born as a result of prayer. We have a partnership with It Is Written.
get? Okay.
itiswritten.com/Eyes for India.
Okay.
And we have a tremendous ministry in partnership with It Is Written, and thousands of people and viewers across the globe are supporting this ministry to help the people, blind people, see.
Okay, wonderful. So again, tell me the website again.
itiswritten.com/Eyes for India,
Eyes for India.
or call toll free 800-253-3000.
Uh-huh. So people can donate.
Yes,
they can-
it's tax exempted because they're sending through It Is Written,
Uh-huh.
and it costs only $75 one eye. It is
Wow.
it's not even as much as a monthly cell phone bill.
Yeah.
So they're welcome to support this ministry.
Uh-huh.
Just one eye changes lives.
Yes.
It's a life-changing ministry.
So just $75, you
Yes.
can restore the sight to the
Yeah.
blind. That's an amazing thing. Now, Pastor, in closing, would you like to appeal to our audience
Yes.
about the lives changed, not just for time, but for eternity?
Eyes for India is transforming the lives of people. It's not only opening the physical eyes of these millions of blind people across India, but it's also changing their spiritual lives. Eyes for India is a ministry, is a hope to millions of people who do not know Jesus. We're excited to take this ministry into the rural areas. If you're interested, we'd like to request you to please join us in changing the lives of these millions of blind people across India through Eyes for India.
And that you can find that information at itiswritten.com /Eyes
Eyes for India.
Thank you so much, Dr. Prabhakar. I know you're a busy man. Thank you for joining us here.
Thank you, Pastor, for giving me this privilege.
And
We thank those millions of donors who are coming forward to support this ministry.
Praise the Lord. Praise the Lord. And thank
Praise
you for
God.
joining us here on another exciting episode of the Mission TV show here at the General Conference session in 2015 in San Antonio, Texas. Bye-bye.